There seems to be a lot of confusion with healthcare practitioners and even patients understanding what elevations of thyroid antibodies mean as far as the aggressiveness of the autoimmune response. So, when you look at a typical lab, let's say TPO antibody range, anything, let's say for some lab, it could be anything above 50 is considered elevated or positive. Now, you could have a scenario where you have a person that has TPO antibodies of 200, which is clearly positive, clearly outside of the normal reference range. And then you could have someone who has TPO antibodies of, let's say, 2,000, which is much higher than 200. And you would tend to think, well, okay, well, the person who's got TPO antibodies of 2,000 has got to be much worse. Their autoimmune disease must be very, very aggressive, and they're in much worse shape. And that's an improper assumption. Now, the reason why that's not a good way to think about it is because the antibodies themselves don't really destroy anything. Antibodies are just proteins that attach to tissues, and in order for the tissue to be destroyed, T cells and natural killer cells have to come in and destroy the tissue. So you could have someone who has, TPU antibodies of 200. They have such aggressive T cells and natural killer cell destruction of the gland that the patient has a very severe autoimmune thyroid condition, and they're deteriorating pretty quickly. On the other hand, you could have someone who has TPO antibody levels of 2,000, but that person's T cell and natural killer cell activity, which destroys the thyroid gland, could be minimal, and they don't really have the severe symptoms and the severe progression of the disease as someone uh, that's 200 levels with very high T cell activity. So the key understanding is that antibodies themselves don't really destroy anything. The T cells and natural killer cells are the key factor in how aggressive the thyroid autoimmune response is. All the antibodies do is just confirm the diagnosis. So they're not markers for letting you know how severe the autoimmune disease is.